Okay. Hi, my name is Marisa McGinley. I'm a neurologist at the Cleveland Clinic. So what we did is we have our iPad adaptation of the 9-hole peg test that we use at all of our follow-up visits for the MS patients. And so right now in the clinic we get a total time just like you would with a 9-hole peg test. But the potential of any digital measures is the fact that you can break apart the data that you get, right? And so in this scenario, every time a patient lifts a peg up and puts it down, we know that that happens with like a timestamp. And so there's just a whole wealth of data, and I think that's true again of like all of these digital and wearable technologies, but the question is how do you digest that and make it something that's clinically meaningful and you can actually use. And so I think there's two potential scenarios, and one is trying to find more sensitive measures to change, right? And so one of the big concerns in the field is how do we monitor progression better, how do we detect that sooner, with the potential of measuring as like a new outcome for treatment trials or allowing for earlier intervention. So I think that that's one focus. The other focus, and something that we did a little bit more with this study, is sort of can we find features from these digital measures that help describe the clinical scenario better. So I know that my patient did the 9-hole peg test and it was slow. But the question is, why was it slow? Was it weakness component? Was it spasticity? Was it dysmetria? Was it a neuropathy? And so, in addition to that total time, which gives you that whole picture, can we fine-tune some of these other measures to give us a better, more comprehensive clinical characterization of our patients? And so I think those are the two potential scenarios of what these digital measures could be helpful with. But again, we can derive a lot of things, but it's trying to figure out which one of those features is really something that you want to take forward to and actually can use in a meaningful way. And I think that's a challenge that everyone's having, is it's like so much data, more data is better, right? But you have to be able to use it. I think everyone is kind of open to that. We will integrate these into our practice, but it's figuring out how to do it in a way that is not more of a burden and is only additive in a beneficial way. And that's a lot. There's a lot of things like we talked about of like developing the features and the outcomes of interest. And so there's that scientific aspect, but then there's also the very practical aspect of workflows in a clinic environment. And I think, the more I see digital measures come out, it's kind of become apparent that there may be two types of them. So one that is, our iPad adaptation is quite specific. It's not just an iPad, you have a special case with it, so it's not necessarily scalable to everyone. It is scalable to some extent, but I think that it is a little more specialized. So I think there's a need for things like that where I think we can be very precise. We can validate a lot of outcome measures, and so they can get integrated into more clinical trials and things like that. But then I think there probably will be another growth of digital technology that is more accessible, more scalable, both for patients and kind of clinicians globally to utilize. They may look a little bit different, in how we use them. And I think, but one of the key things for any of this is that it has to be integrated into clinical workflow. And I think that's the reason that, ourselves and, the several other sites obviously that use this technology use it consistently and find it is only a value add, is because it's integrated into the clinical workflow. Our patients come in, they sit down, they do this intake process just like they would be getting their vitals and doing their med reconciliation. And then the information is immediately in our EMR, and we use it at the clinic visit in real time, and it's populated in our notes. I don't even have to necessarily go find it. So I think that makes it easy for a clinician to want to use it and actually engage with it. And then you're engaging with it, then the patient's excited because they're like, oh, I didn't sit there and we're not even doing anything with that, right? Which is most of like the questionnaires I feel like you fill out for a physician's visit. So, but I think that's a really important thing. It's not only that we have to find really valid, useful tools, they also have to be usable for both patients and clinicians. I think both, telehealth and digital measures are here to stay in some capacity. It's just figuring out the best way to integrate these and sort of what do we move forward with as, an MS community. And I think that's going to be like a hard decision, and I think that it's not going to be a one-size-fits-all for any of these things, and we're going to have to think about more personalized, health delivery approaches and clinic workflows, and it may look different for different scenarios, and so I think we have to be willing to adapt, but also rigorous in the methodology to our implementation.